Hi, it's Jessica DaMassa with WTF Health. I'm here in the HISA studio at HIC 2019, and joining me right now, I have Elizabeth Deveny. She is the CEO of the Southeastern Melbourne Primary Health Network, and in her spare time, she is the chair for the Australian Digital Health Agency. Pleasure to have you with me. You're a busy lady.
Thanks so much for inviting me.
Oh my gosh, so okay, you are who I've been waiting to talk to, basically, I think all day. So tell me what's next for the Australian Digital Health Agency. Let's start there.
Okay. So I think we've got two pieces of work. The first is really about our My Health record.
Right.
So we stood that up early this year. We've got now 25 million Australians who can use a My Health record. That's just an incredible achievement across the country. So the first part for us now is making that work.
Right.
So you've got a record. Do you know you've got a record? Does your clinician know how to use it? What information's in there? How can we improve it? To be honest, governments work pretty slowly. I know you've got a lot of viewers who are startups and they go, right?
Yep.
Governments are slow, and by the time we implement something, maybe it's time to be refreshed, yeah? So the challenge for us is implementing it and keeping it fresh and moving forward for 25 million Australians all at once.
Yeah, and that's a big undertaking. I mean, so when you look at what is the immediate next step, and after the awareness is raised and people start using this, I mean, do you even know what the issues are at this point, or are you still trying to ferret that out?
So I think we're aware of some issues. Some of them are legacy issues with the record. I think, and the others are really, it's more about communication and awareness. People understanding how to use it, and us as an agency understanding what people want from it. Then the next question is always funding. So everyone will tell you they want A or B or C done, but no one ever wants to pay for it.
Right.
This is always true,
This
right?
is a global problem in
Absolutely.
healthcare.
People want everything fixed for nothing.
Right.
So then our challenge is, I mean, we could go and ask the health minister or the government for more money, but to be honest, I can know what their answer is likely to be. Really, it's us leveraging off all of the capacity across the networks that we all have. How can we learn and share and do things better together? We talk about crowdsourcing,
Right.
we talk about working collaboratively, but I don't know we really do it that well. I think we talk a lot about it.
Yeah.
Then we go off and do our own proprietary thing. So I think for us it's finding mechanisms to actually bring everyone together, and so we can have that really good conversation and then get some buy-in.
Yeah.
Not just talking about what we could do together. I want your money on the table. Let's
I love
do
that.
something together, right?
All right, help me understand and help my viewers understand who may not be familiar with the way the Australian healthcare system works and where that money that's going to be thrown on the table is coming from. So how are things funded here, especially things on the innovation side, on the digital health side? Where's that funding coming from? And like if people were wanting to, have their solution looked at and integrated in, if they're a startup, or if it's an investor who wants to throw some money in with whatever the Australian government is throwing in on, how do we find that out?
Well, in Australia we tend to think that funding comes from the governments. And certainly the agency that I'm the chair of is funded completely by the state governments, the territory governments and the national government. So it's completely funded by government. However, when we look at the health spend, most of it comes out of ordinary people's pockets. And people are buying things every day.
Yeah.
They're buying an app for mindfulness, they're buying something to track their walking or their diet. So a lot of the funding comes from
Consumer,
you, right? And then private organisations also doing a lot of funding their own activities, sometimes getting on with things while they're waiting for everyone else to catch up. So there are lots of organisations, private health insurers, private hospitals, practitioners. Sometimes they group together, sometimes they work individually. I think there are a lot of opportunities there to identify needs and to help people work together. I'm a big fan of design thinking, so I would say, okay, come and work with us and let's work out what the clinical issues or the consumer issues are. And then my question to you is, can you fix it for us? Can you be part of the solution?
This sounds like something that you do in your day job as CEO of the health network that you are running. And so you explained to me that what you do there is it's like you figure out how to provide a service that you didn't even have a market for to begin with. And we were talking specifically about the example you gave was telehealth. What other things are you looking for? I mean, are you solving problems that exist in the clinic, or are you looking around at like what other countries are doing and trying to bring in best-in-class solutions? How are you sourcing those things?
So we do a couple of different things. So 2 years ago now it is, I went to the US for the first time. Because we're looking for an innovative solution around drug and alcohol problems.
Okay.
So the government gives us money to put service models in place, and we could see that there were gaps. There weren't the models there that people needed. But surprisingly, your viewers might be surprised to know that there has been an issue with drugs in the US over the past 20 years.
Yeah.
And so there's some really groundbreaking work that occurred, particularly in California and Los Angeles, where meth and cocaine first really started, sadly. So there have been great clinician researchers, built fantastic models there. We went over there, had a look, said this is for us, brought it back, and then we were able to fund that. Because we commission services, we can specify what we want.
Okay.
We're not bound in the same way that a government might be to what it's done before and before and before. So we provide service models. Another really good example of work for us is in my catchment, there are 1.5 million people. And we know that the health dollar tends to be spent at the end of the road when the people are already sick.
Yes.
And we really want to try and do something earlier on.
Okay.
But we've got a small budget to work with there. And so we've found a solution actually originally designed in the UK through the NHS, but also used by the Department of Veterans Affairs in the US, which is a telehealth solution which uses simple text messaging to motivate behaviour change. It's called Nellie. If you're interested, your folks can look it up, and we've got some great videos showing how just that simple connection, and it's really interesting the psychology around text messaging. So I would say to you today, when we finish this interview and you look at your phone, there'll be a lot of notifications, right? Where do you go first, Jessica?
I usually check the text, honestly. Yep.
There you go. And why is that?
Because the most important things are texted to me.
Absolutely. It's the most important people that you talk to.
Right.
So we've got a solution that works with that psychology. People describe the persona or the avatar, Nellie. Her name's Annie in the US, and Florence after Florence Nightingale in the UK,
I love it.
as being like their mum or their sister or a sexy aunt or goodness knows who, right? But a person who's actually invested in their well-being, and somehow that helps them make the connection to make the behaviour change they need. So we're always looking for new ways to help, both at the preventative end of health as well as the clinical end of health, and new ways to do things.
How do we find out what is on your agenda of the problems you're trying to solve? Because those were very specific clinical asks. And I know the Digital Health Agency has, it's like priority areas that it's focusing, but those are very big and broad. So as far as these actual clinical problems you're trying to solve, how do we find out about those?
So for the agency, if you go onto the website there, you'll be able to look at our 7 key digital platforms we're trying to work on. And there's a lot of information there about the things we're trying to do and opportunities to join in. There are 31 primary health networks around Australia.
Okay.
On their website, they'll put their needs assessment, which will talk about the needs in the local area, and their work plans, what they're planning to do next, and the things they're interested in. So there's 31 opportunities there across the country. Go and find out what we're interested in. Talk to us.
Is that the way in for a startup coming from abroad, whether it's Europe, UK, US?
Absolutely. That would be one of the ways for sure, to start to understand what it is, the data we're collecting, what the problems are we're seeing, and what are the problems we're trying to resolve. That would be a really good starting point.
Talk to me about the health consumer here in Australia. So this has been getting, it's been, the conversation around the idea of the healthcare consumer has been ramping up. And in a lot of these conversations, it seems like the health systems are saying, oh, well, the consumers are demanding different things. Or you even said yourself, people are buying their own apps, they've got their Fitbit, they've got their Apple iWatch, it's doing all of these other things. How do you see that playing out in Australia right now? In terms of the consumer appetite for taking control over their own health, especially when they're enabled by something like the personal health record that you guys have.
So I think consumers are going to drive the change probably more than government and more than clinicians. And I think that's because their expectations of what's normal in the other aspects of their life, retail, banking, they're going to translate that into health and start demanding things. And we see that already. People talk about Dr. Google, clients and patients coming in with reams of paper and saying, look at this, why did you prescribe me that?
Right.
How did you do this? And I think for clinicians and policymakers, we really have to challenge our notion of what it is consumers want. So my mum's 77. Hi, Mum. She's completely connected at the hip to her iPad.
Awesome.
She expects everything to be available on her iPad. And recently she was in hospital. She tried to get a discharge summary. Huge problem getting a discharge summary. A lot of phone calls, and eventually got them to email it to her.
Oh,
Not secure, of course, but better than nothing.
Right.
I've got a 20-year-old son. Obviously I was a child bride because I'm far too young to have a 20-year-old.
Especially up close and personal.
So my son has a completely different idea of how the digital works for him. So last year I was having a conversation with some people in my local health department about drug and alcohol services, and they were talking about a clinical model which had to start with a face-to-face encounter. And I said, why?
Right.
And they said, because the first assessment must be done face-to-face and it will build rapport. And I said to these people I was working with, to be honest, for my 20-year-old, face-to-face is highly confronting.
Yes.
If you want to build rapport, you build it through social platforms. And when he feels safe and comfortable to disclose, then you might be able to get him face-to-face. I mean, these young people, and, I like to think of myself as young, but honestly, they don't talk on the phone.
No.
They Snapchat, they Instagram.
Oh my gosh.
They do all kinds of things like that. Where we think a phone call or a face-to-face meeting at my age feels normal, for him that feels weird. My mother, because of her disabilities now as she's got older, is not able to get out as much as she does. So she uses, blogging and vlogging and all kinds of other ways to connect. Yeah. So I think that we have a pretty static notion of the health consumer, and we do think of them as passive as well. I think they're dynamic. I think they're really different across the ages, and I think we need to take a good hard look at what they want, because watch out, they're coming for us.
Even though they might want this, do you think that they have the capability to do as much digital as we're giving them credit for? Like, I always wonder too, even when it comes to data ownership and managing their own health data. I mean, sometimes I think people are either, like, health literacy is just a disaster worldwide. People don't understand the health system. They don't understand what their plans are paying for. They don't understand things like that. And then we're going to give them control of their health data and expect them to make decisions like a consumer would when they're buying a TV or buying a pair of shoes. Is there a mismatch there, you think, in capability, and how do we overcome that?
I think that's really a good point you've made, Jessica. So we know from health promotion research that when we put any kind of health campaign out, stop smoking or wear sunscreen, that the people who are already health literate get more health literate, and the people who are not health literate don't tend to engage with those programs. So I believe that, years ago we'd say that education was the most significant social determinant. I actually think it's digital literacy now.
Really? Okay.
And so I think if you're not digitally literate, your ability to connect with all kinds of things, including your health providers, will be minimised. And so we risk doing harm. And I've talked in both of my jobs about our role, it's kind of the standard medical role, do no harm. In the digital things we put in place, we have to make sure that we don't further marginalise people who are already marginalised by their culture, their location, their financial situation. And I think there's as you've kind of suggested in your comment, there's a possibility that could happen as we digitise things, that people who are savvy, so for Elon Musk it'll be fine, right? But for some other person who doesn't speak English, has got significant mental disorders, homeless, can't afford to pay their phone bill, doesn't have Wi-Fi, we're going to really disadvantage them as we move everything across. I think it's up to us, all of us and the leaders in health, to make sure that doesn't happen. And if it does, it's on us, and shame on us.
I absolutely agree. I had an interesting conversation with a chief information officer of a hospital system in the U.S., and he was saying they were looking at even the ability to not have a phone number. Because some people in America, will have, they have them here, the temporary phone numbers that you can use on a pay-as-you-go mobile plan. If you don't have a consistent phone number, and you're starting over with a different record every time, or you're starting over with a different number every time in an app or whatever, we're going to lose all of that valuable information.
We were talking to a colleague recently who was working with a lot of disadvantaged young women in a sexual health clinic. She said, so we find out they've got a positive result, say to chlamydia, and then we ring them back on that mobile, they're not using it anymore.
Right, terrified.
And how do we tell them they've got a positive result? Meanwhile, they've got chlamydia. Okay?
Yeah.
We know this is a real challenge, and in some of our systems, you can't get access unless you've got a postal address. What if you're homeless?
Right.
What if you're scared of putting your name and address down because your partner said, I'll find you and kill you if I can find your address anywhere?
Right.
But there are real issues for people in doing that. We have to get better at it.
What is the conversation around social determinants of health here in Australia? So in the States, this has become another hot topic recently, in particular. Is it the same here? For our viewers who are not from here and want to understand that the healthcare ecosystem and the climate and the healthcare consumer and the world they're living in, what are the social determinants of health here? Are they the same, or are there some that are more critical than others?
So I think that probably over the last 10 years, social determinants of health were spoken about less. We've seen governments disinvest in prevention and promotion and focus much more on the delivery of clinical services. But I feel like in the last couple of years that conversation started again. So politically the wind's changed, and people are understanding that they keep investing in the most expensive part of health, which is the acute part.
Right.
It's not sensible,
no.
right? For us, I think housing is a really big one that's coming up more and more.
Okay.
The impact of not just sleeping rough, but being in precarious housing, not mortgage stress, not knowing if you can pay your bills, the impact that has on your mental well-being, a lot of decisions you make, on family violence. There are a lot of interconnections there.
Yep.
So there's a lot of conversation around violence, particularly family violence. There's a lot of conversation about some of the kind of tried and trues, like, poverty and inability to speak English, is our language in Australia. So those things come up too, but I think more and more what we're seeing is a lack of access to really safe housing and other supports really driving people's disadvantage.
Last thing I'm going to pick your brain on is about the big tech companies, the consumer tech companies from the U.S. This is another big news thing in the U.S. I mean, I'm sure globally, everybody's talking about what's Amazon going to do with Haven, with Berkshire Hathaway and JP Morgan. What's Google going to do? And then, oh my God, what is Apple going to do? They've got how many patents for things that can be integrated into your watch? The last one we saw released was the EKG. So, as far as the Australian Digital Health Agency is concerned, or even in your role running a health system, what do you think about the big tech companies come in? Is there a trust factor there? Are you leery of them, interested in partnering? What are your thoughts?
Well, I think that they're not homogenous. So if you ask me how comfortable do I feel with pretty comfortable, because that's something they've worked